My name is Dr. Mark Hagy, and I'm an orthopedic surgeon at Virginia Orthopaedics. I work primarily on an inpatient basis out of Lewis Gale Hospital and operate on an outpatient basis at Roanoke Ambulatory Surgery Center. I'm subspecialty trained in the lower extremities, specifically the knee and the foot and ankle. And my institution of training, the University of Iowa, is primary center for joint arthroplasty and literature in joint arthroplasty, and so I've done a lot of had a lot of hip training as well, so I do some complex hip cases. But in addition, I do general orthopedics and take trauma call or orthopedic call at Lewis Gale Hospital. Well, when I first came to the Valley, I knew exactly how I wanted orthotics and certain prosthetics made, and I had some understanding of materials and processes. And so before I'd even started my practice, I went to the three or four places around the Valley and just said, hey, I'm going to be a new doctor in town. And when I went to Virginia Prosthetics, they didn't try to sell me anything. They didn't try to do anything but understand who I was as a physician and what my goals were. And from essentially that point forward, they have helped me help patients. And so basically any foot and ankle issue that I have goes to them, and I will write what my needs are. And the level of communication is just so high and so good between us. I think the key is that they really have kept the patients that I send them and that work with me in the forefront. I'm able to write a prescription for the specific item that I want. I'm also able to work with a prosthetist. Usually they have a group of them that are quite good, but I'm able to work through one specifically who's really knows what I am most interested in providing, and they are able to really tailor what I'm interested in helping the patient out with, and meeting that patient's need with a nice fitting orthotic or prosthetic. And they're very, very good about following up and making changes, because that's almost an inevitable part of the process. And they really do a good job at that. They're also, very, very pleasant, because, when people are sick or people aren't feeling good, they're often not nice. And they do a very good job of weathering that storm and really, really helping patients out. I mean, I can't even tell you how many times patients tell me, I just love that process, and they were really good about it. And, with cost being an issue and everything, I really think they provide a good bang for your buck product. And that's what it's about, because if the product is working and the process is relatively seamless, then folks are satisfied. And that's how they help me. The biggest challenge is the mental or psychological challenge of losing your extremity. Most of the patients that I have dealt with have had chronic disease and have had some sort of smaller amputation prior to getting a full lower extremity amputation. And then the next part would be the physiologic or physical aspect, because it takes more energy, more oxygen, etc., just to ambulate with a new extremity, be it a below knee or actually a below ankle or above the knee amputation. And really, to be quite frank with you, I do a lot of counseling about that beforehand, but once the amputation has been completed and once the wound is healed, that process has been actually, again, very smooth. I mean, Virginia Prosthetics has so much knowledge, and they have at least 3 employees that I'm aware of that are amputees themselves, that they're able to give firsthand knowledge and just educate the patients about the entire process. And patients really don't have any other questions for me. It's pretty much as simple as that. It's actually a little bit of a difficult sell because they're losing their extremity. And they have to kind of go through the process of really experiencing it for themselves and kind of coming to grips. But the largest majority of patients that we have in our society and that I deal with, again, have a more chronic condition. So even though they don't admit that they know that maybe an amputation is coming, they do know. The hardest part about it is that the power of denial is just amazing, because even if their leg is completely not viable, they still think it's viable. So and losing their leg becomes a negative. How I really help transition them over to a positive is that showing them and explaining to them how receiving the amputation in and of itself is going to improve their immediate function and physiology, because often they're infected and or sick related to it, or they have so much pain they can't tolerate it. So, and generally just the process itself will become so uncomfortable or overwhelming that they'll then, come to peace with that situation. So the negative will become a positive. Then once the process is completed, at least from a surgical standpoint, how physical therapy and how the prosthetist and how all of those folks really talk with them about, reaching daily milestones, be it just getting up and simply going to the restroom or getting a drink of water, versus now finally being able to ambulate in a store versus being in a wheelchair or being on something else. They start to talk with patients and show them what they can do, and then inevitably that negative becomes a positive. But it's something that someone has to really experience more than the doctor saying, hey, we're going to do an amputation and you're going to be better off. So that's kind of how I approach the process, I suppose. Anytime that I've ever called them and had a patient, because I have a lot of patients that live outside of the Roanoke Valley, hours or so away, the place here has been very willing to see them straight away. And the last thing is the fact that they have this the outreach clinics that they have, that's been vital. Because I know the folks in Galax and Hillsville or Vesuvius, Virginia, are getting the same level of care that my patients, close to the big city are. And that's very different from the overall healthcare model that we generally have. So at least from an orthotic and prosthetic standpoint, I know that those folks are getting exactly what I would give everyone else. And that actually gives me a good deal of satisfaction. Yeah, okay, I got something I'd like to add. Probably about 2 months ago, I had my first complaint about Virginia Prosthetics in my office. And because I had such a good relationship, and I think the decent thing, I want people to tell me if I'm not doing the job that they think I'm supposed to do, because that's the only way to improve. I called Doug Call and I said, Doug, I'm a little worried because I've gotten my first negative feedback about your business. And within a day or two, I'd had a couple communications, and the staff at Virginia Prosthetics went back to all my patients. They called them all. They did a survey, a formal survey to figure out, how they thought they were treated and what process it had been. They actually went over like 3 years of patients. And although, we don't like to necessarily focus on the negative and when talking about one's business, it's really how you step up to the mic during a time of adversity that really kind of shows what you're made of. And I thought that spoke volumes to me. So they called all those patients and they wanted to do the right thing. Because ultimately, I mean, that's what's kind of lost in our society today is nobody wants to take responsibility ultimately, and nobody wants to really do what the right thing. We know what the right things are. We were all in kindergarten, but it becomes somewhat more complex as we get older for reasons I'm yet to understand. But Virginia Prosthetics certainly stepped to the mic in that occasion. That's what I wanted to add.